I've been doing hair since 1977. It's been a passion. It really is. I just love it. My wife came in to help me because she was already retired. I don't think she ever realized how hard the job really was. And it's like, stand there like this with your arms up in the air. It doesn't work well. All of my doctors were mostly associated with Highland Hospital. We trusted the people at Highland. My first surgery for rotator cuff was in 2007, and then 6 months to the day after that surgery is when I had the aneurysm. I was at work. My legs and my feet swelled up so badly I had to take my shoes off. So I called my doctor at the time. He said, I don't want you to go to anybody but Dr. Hirakawa. My 6-hour surgery ended up being almost 13 hours. And they didn't give me much of a chance to live. I was in a coma for 21 days. They took care of me. I'm alive. I don't know if I would have been if I would have gone anywhere else.
I think that Highland is a great mix of a lot of different things. It's a big enough hospital where you can get most of your medical needs met, but it's a very comfortable environment in which to get care. It's easily accessible. It's a slightly smaller group of doctors, nurses, team members, so I think you're more likely to kind of build a familiar relationship with those folks.
I have been at Highland for 23 years, and I have been a senior nurse manager for the last 7 years. My approach to patient care is getting to know the whole patient, not just why they're here in the hospital with us, knowing what their goals are, what drives them while they're here to get them back home is really helpful. While we do our best to make it as comfortable as possible, home is the most comforting place.
Someone like Mr. Soldi, who has had a wide range of experiences and interactions with Highland Hospital, he encompasses a lot of what we aim to do. He dealt with a tough situation over a long period of time and received expert care while an inpatient. And then, the other side of that coin here at Highland is he's had some relatively minor in and out type procedures and has experienced the benefit of being able to get those things done in a comfortable, safe environment.
I had some shorter stays. I had some kidney surgery that they sent me home within 2 days. I had shoulder surgery. I went home that day. Being able to go home was just so much easier than staying in the hospital for so long. You know that just in case, the hospital's still there.
I think one of the biggest challenges that patients face while being in the hospital is the inability to keep their normal sleep pattern. The noises of people in and out of your room, call lights, monitoring, things like that does not allow for restful sleep. So that helps them most to be able to go home, get the sleep that they need.
As surgeries have become less invasive, we've been able to make great strides in their recovery process, and their length of stay has consequently decreased. A surgical short stay unit will offer patients and their families an opportunity to kind of have a private, comfortable space for them that's perhaps a little bit separate from the rest of the hospital. We've been able to design it literally from the ground up in terms of what we want.
Having a short stay unit allows patients to have a specialized care team. They are going to have a care team that understands post-op recovery and can streamline that process for them. Right now, we don't have enough beds to do that, and so building the short stay unit keeps the patients that need short stays in short stay beds, and those patients that need longer stays or acute care can have those beds.
I don't want to be stuck in a bed. I want to go home. You're more comfortable at home.
Oh boy. It's you!
Oh my God, you look wonderful. Dr. Hirakawa was in my room every single day, no matter what time he got done with surgery. If it was 1 o'clock in the morning, he would come in my room. I cried when I heard that he retired, because I didn't get to say goodbye. You mean so much to me. Still cut hair. I love cutting hair. To me, it's my art form. Cooking, that's my art form. I love doing those things. We joined a golf club. I fish. I'm with my buddies. I've been living life to the fullest.
For me, the honor and the ability to be able to care for someone else or someone's loved one is really why I went into nursing. Creating that trust in a small amount of time, it fulfills me as a nurse, as a person. For them to be part of this culture of Highland, giving and donating for this new space, you become part of our Highland culture, part of our Highland community.
Highland means the world to me. It really and truly does. If somebody said to me, what hospital would you go to? I'd say Highland. It's a little smaller, and I think they take phenomenal care of you.